David, could you talk about the role of the World Bank and what your priorities are on HIV and what your team does, maybe what you see as sort of the future of your team, and I'd also be curious if you could maybe talk a little bit more about some of the other international organizations, particularly the Global Fund, and how you think they're doing.
Yeah, sure. Okay, just a bit of background on the World Bank. We've historically been the largest overall development agency. But a challenge we faced is that for political reasons, the US has wanted to remain the largest contributor to the World Bank. Mm-hmm. And as a sort of gentleman's agreement, and I'm using that word deliberately, other donors don't exceed the US contribution. DFID did, partly when the pound was strong for the first time 2 years ago, but that has returned to before. What that has actually meant for the World Bank is that our capital increase, which determines how much we can lend, has been dramatically smaller than the regional development banks. So we've had about a 20% capital increase. The IADB, the Inter-American Development Bank downtown, has had a 70 or 80% capital increase. The AFDB and the Asian Development Bank have had 70 or 80% capital increases. So increasingly they're going to be in a position to lend close to as much and cumulatively more than us. So in truth, our size is waning. The other point is we had our largest ever IDA replenishment, which was about concessional financing last year. But there was quite a lot of really smart smoke and mirrors in that. We got people like the Chinese and the Indonesians to pay back money early, but you can't do that more than once. We banked some of our IFC profits in a way that made IDA look good. Bottom line is we're going to get less IDA this year. So what I'm trying to say is in development as a whole will be a smaller institution. In health up until now, our role has really declined as a result of the huge US initiatives. A decade ago, we were about 22% of global health financing. Today, we're about 4%. If we look at AIDS as a specific issue, I do think that the MAPS were transformative as the first $1 billion HIV initiative and helped to make it easier to make the case for PEPFAR, the Global Fund. But I also think that the MAPS were driven by a desire to disperse money fast. And so we have a bad legacy. People associate AIDS projects in the bank with unsuccessful projects. They're seen as projects that are automatically going to run into difficulty. So up until now, our portfolio has declined a lot. And this is the other structural problem we face. And here, AIDS is really a microcosm of wider issues that we all face. The reality is that there has been so much free money for health and education in Africa in the last decade that most low-income African governments have outsourced responsibility for health and education to Western donors. And they've been very loath to borrow from the bank. We're lending more to Africa than ever before, but it's all for infrastructure. They don't expect to have to borrow for health or education. They expect free money. That's changing. And the extent to which that change involves the World Bank is going to be an important issue. We do have new leadership. We have a new vice president for the Africa region, which is a very important position. And as you know, we have a new president who's historically been very committed to HIV, TB, and to health and equity. So things may change, but I guess I would caution about the size of the role the bank can play based on the constraints we face with regard to our capital increase and our future IDA. So we could play some role, but maybe not a huge role. I think finally within the bank, we are an institution that got dominated by macroeconomists, and we've really fallen into a polarizing position about health systems versus specific disease interventions, and tried to push health systems as a whole without convincing clients or governments that we have the product they want. And we've lost a lot of ground in the disease-specific interventions. And at the same time, we're seeing some extraordinary evidence of what malaria programs are doing for under 5 mortality. One of the things we wanted to touch on is just completed a study in Kenya. Most countries in Eastern and Southern Africa are seeing Eastern Africa in particular, are seeing the fastest declines in under 5 mortality in 50 or 60 years. And In Kenya, we did a really careful analysis. The bottom line is 58% of that decline was attributable to malaria prevention, principally to bed nets. So that's huge. I don't have to tell you how economical and affordable they are as interventions, but we've lost a lot of ground in funding discrete things which work and which people want to borrow from. Final point to touch on, and I think this is one of the sort of really relevant development points I'd make for PSI and for all of us. I don't think we have paid sufficient attention to how the rapid economic growth we've seen initially in Asia and now in Africa has transformed countries into middle-income countries who increasingly won't be receiving development assistance. And you've seen that in Asia, that as countries become middle-income, development assistance is closing out. The problem now is we're seeing the same thing in Africa. Ghana and Zambia are already classified as middle-income countries, which means increasingly they'll be less eligible for concessionary aid from the bank. Countries like DFID, which have a strong poverty focus, may reduce their resources to them. The next wave of middle-income countries, and it could be a few years away, include countries like Kenya, potentially Nigeria. So where I'm really coming to, and this is very much a PSI message, is our expectation is low-income countries are largely going to be fragile and conflict states in the next 3 to 5 years. The people who are going to be left behind are going to be the fragile and conflict state countries. And you're probably seeing that in your portfolio, huge portfolios in fragile and conflict states.
Can I ask a quick
Yeah,
follow-up?
please.
We're definitely interested in, finding ways of getting some funding from the World Bank and looking at, I wonder if you have sort of some ideas for us.
Sure.
What are some opportunities for an organization like PSI to access funding? It's
Sure.
historically been quite challenging for us.
I think there are genuinely some pieces of potentially promising news coming out. One example is, believe it or not, the country where we think we've been able to make one of the most tangible contributions to improved health outcomes, especially maternal and child mortality, has been Afghanistan. And our model in Afghanistan has largely been to work with the government to contract NGOs to deliver services. This is being written up as the bank's top success in health in the last 5 to 10 years. We've got a similar success in the Congo, where our bank health program is largely implemented through NGOs. You may know an economist called Paul Collier, the bottom billion, whose bank tried to recruit as a chief economist, but he didn't want to leave Oxford. But I think he makes a really powerful point that in fragile and conflict states, the role of the government should be to spend years developing their regulatory and their supervisory capacity while private actors deliver the services. The other point I would stress is I think that our new president's model of partnership is going to be much more implementation oriented. A lot of our partnerships have been global and at the UN level and haven't contributed to service delivery. I do think that will change. I think the biggest opportunity in future for PSI Bank partnership would be in a couple of areas, and fragile and conflict states are one. I think there's probably going to be joint research and analytic work we can do in things like improving service delivery, improving efficiency, improving integration. So I think those opportunities will also be there. Yeah, I think it's worth studying the bank quite closely because of its complexity to look at entry points. But there's no question some of our best health and education programs have been delivered through NGOs. So, I mean, the classic case in question is Southern Sudan, where we have whole districts where the literacy rates are honestly below 0.5%. And yet the first request that the Southern Sudan government made of the World Bank, and the request actually got to headquarters before it was seriously questioned, was for a university, for a training college. In short, I think opportunities will expand, especially in fragile and conflict states.